classic vitamin K deficiency bleeding can occur in anywhere from 250 to 1,700 births per 100,000 births. And so, that is low. That's up to 1.7% of births, right? Which does not sound high.
Yeah.
But if you think that there's 4 million births in the United States each year, that's 68,000 babies. That's 68,000 babies that we're preventing something that's 100%, almost 100% preventable, right?
Right.
With a single shot that has a very strong safety profile.
Late stage vitamin K deficiency, which I have seen in clinical practice. And so have I seen it a lot? No. In my residency, I saw it 3 times. All of the situations were children who did not receive vitamin K at birth. Most of the ones I saw were actually late stage, so between 2 weeks to 6 months. The devastation that you see, you're never going to forget as a clinician. One of them had intracranial hemorrhages. So remember, vitamin K is there to help clot blood. So if you don't have it, you're going to bleed. And same thing with the other children. This one child I will never forget, it was the 3-month-old who had bleeds down the spinal column and in the brain.
Prior to 1961, which is when the American Academy of Pediatrics started as their standard of care, recommending these shots to all infants, decades of research were done because we were trying to figure out why babies were dying of these bleeds or having these devastating bleeds. And they identified vitamin K, and they identified that giving vitamin K to babies helped to prevent these bleeds. And the vitamin K shot, prevents vitamin K deficiency bleeding in nearly 100% of babies.
Welcome to the show. Thank you so much for tuning in on our YouTube channel. Make sure to subscribe and comment if you like these episodes, because I love being able to bring my podcast guests to the YouTube channel. And I have a returning guest today. Her name is Dr. Jessica Knurick, who has a PhD in nutrition science, a registered dietitian with an emphasis on pregnancy and postpartum nutrition. Today's episode, we are chatting about vitamin K, the controversy behind it when there really shouldn't be, separating science from social media myths. Thank you for coming back on the show, Jessica.
Yeah, I'm so excited to be back. Thanks.
Well, I'm excited to have you on again. I loved our last conversation. Like I already said, I'm curious, how did you get down the rabbit hole of fighting vitamin K misinformation online with your platform?
Yeah, so I think if I remember correctly, it's just somebody that was following me asked me a question about it. And so I made a video basically describing why we give vitamin K, the importance of vitamin K in preventing vitamin K deficiency bleeding, and why it's given to all newborns, and kind of the history behind it. And not like it was so innocent. I was just innocently like educating on vitamin K. And the backlash that I received in the comment section was very surprising to me, because I just hadn't, again, I was kind of like new to content creation. And so that I just started kind of answering those questions. So all of like the criticisms or I guess the concerns from people. I sometimes don't like to use the word concern, because it's like almost more than concern. It's kind of like blatantly spreading misinformation.
Yes, correct.
And so it's, which is so different than like when a parent actually comes with a genuine question, which is a concern, right? I view those very differently. So yeah, that was how I got involved in it, and then it just kind of kept going from there.
Oh, yes. And it keeps on going. I feel like, for a lot of the parents listening, we're going to get into vitamin K in this entire episode. But when babies are born, especially in the United States, we do something called the eyes and the thighs. That's something that nurses will always just say that terminology, and maybe they'll say it in front of you. But it includes 3 things. It includes erythromycin ointment for the eyes, which we're not talking about that in this episode. It includes a hepatitis B vaccine, and it includes the vitamin K injection, which is what we are talking about on this episode. But as I can attest to, and I'm sure, Jessica, you've heard it too, all 3 of those things are being attacked as being not necessary for babies. And I will be doing a future YouTube episode about why we give it, whether you can refuse it, why I don't recommend you refusing it, and why it's something that is beneficial. But right now we're going to talk about vitamin K. And I'm so glad that you're going to be able to provide some of that background and sort of where this sort of misinformation is coming from. And I really appreciate you saying that there's a difference between misinformation or disinformation as well as a true parental concern, because our goal here is to talk about those concerns, which I love talking to my families about. What are the concerns you have? How can I, answer those concerns in a way that is obviously evidence-based, but also from what I see clinically. So first question for you is, what is the purpose of the vitamin K shot, and why are newborns at higher risk for vitamin K deficiency?
Yeah, so vitamin K is a fat soluble vitamin that our bodies, our gut bacteria can synthesize some of, but we also have to get it from our diet. So
Mhm.
you get it from thing like mostly plants, like green plants. So green leafy vegetables are a big source, and so it's essential for something called preventing vitamin K deficiency bleeding. It's essential for blood clotting. So
Yeah.
it basically helps to basically helps to what's the word help blood clotting factors basically
Yes.
to be activated. That's the word I was looking for. Activate blood
Yeah.
clotting factors. And so if you don't have it, those clotting factors can't activate. And so, which makes the blood not as able to clot, which can lead to things like vitamin K deficiency bleeding. And so that's really the importance of vitamin K for everybody, for all humans. All vitamins kind of prevent deficiency diseases or deficiency conditions. And so vitamin C, for example, prevents scurvy. Vitamin D prevents
Yeah.
rickets, and vitamin K prevents vitamin K deficiency bleeding. And so prior to 1961, which is when the American Academy of Pediatrics started as their standard of care, recommending these shots to all infants, decades of research were done because we were trying to figure out why babies were dying of these bleeds or having these devastating bleeds. And they identified vitamin K, and they identified that giving vitamin K to babies helped to prevent these bleeds. And the vitamin K shot, prevents vitamin K deficiency bleeding in nearly 100% of babies. You can't really ever say 100%, but it's as close as you can get to it.
Yes.
And
Oh, yeah.
so that's really why the shot is given is
And
to prevent
what
that.
yeah, and what are the controversies you're hearing about it? Especially online and, even in practice that you've, been in, but what are people concerned about, in a or what are they let's say, what are they spreading misinformation about that concerns you?
Yeah, so I think that it gets lumped into vaccines a lot. So I
Yeah.
think with the anti-vax movement that we're kind of experiencing right now, it people just identify it and think it's a vaccine, and I see this in my comment section all the time. They call it a
Yeah.
vaccine,
It's
and
not,
so I
I
really,
know. Yeah.
it's really not. It's
Yeah.
it's vitamin K, and the shot is just the most effective and efficient way to get vitamin K to newborn babies. And so I think that's one, is just identifying what it actually is. I think there's a misconception about what it actually is. I think also you can't discount the fear of just, and you've been a brand new mom, and I've been a brand new mom, and even me knowing exactly why vitamin K is given to newborn babies. When I first had my baby and I realized that they were going to put a shot into my baby, I was like, oh
Yeah.
no. Even though
Yeah.
I knew, like how important it was, it still like tugs at your heart, and you're like, but this is my brand new baby. And so I think there's a fear there, and I think so there's an innate fear, and maybe fear, I think fear is the right word. And then but you pair that with, because again, I even experienced it and I knew the importance and I knew the safety profile of the shot and I knew why it was used. But you pair that with somebody who's heard a lot of misinformation online about it, and is already scared that it's going to hurt their baby, right? And I think that that's kind of a recipe for disaster. It's really targeting vulnerable populations, and I think that's why we're seeing kind of this misinformation about it. And so a lot of what I see is just that it's going to hurt babies. I see that which there's absolutely no evidence of. There
Yeah.
has This shot again has been given routinely all around the world as standard of care to newborn babies, and in the United States since 1961. And so this is not a new thing, right? We have decades and decades, over 60 years of research, both clinically and in the research space, to show that it's safe and effective. And so there's just no evidence of it being harmful. There hasn't been a single case reported of an infant dying from the vitamin K shot, and it saved thousands, millions of lives. Um, so trying to get that across and trying to show the data of kind of what I just said is one of the things that I do. Um, I mean, I can go. Do you want me to just go through all of the other things I
I
hear?
Yeah, I would love to. I mean, I think this is what this is about, right? And I mean,
Yeah.
I will definitely be attesting to the clinical aspect. We'll talk about that
Yeah.
in a bit. But this is one of those things that I want us to talk about. And before you get into that, thank you for differentiating that it is not a vaccine. And I already know that the Hep B vaccine is something that parents should get and is safe to get early on. But because it's something that's called a shot, I think people assume that, oh, a shot equals
Yeah.
vaccine. It's an injection that is a vitamin, and I would love to hear the other misconceptions that you're hearing.
Yeah, I think another one is let's just kind of talk about what the stages of vitamin K deficiency bleeding are, because
Yeah.
I think another one is that it's super rare. So, why are we giving it? So, I just want to kind of clarify why we give it as a prophylactic shot, which
Yeah.
means not all babies are going to get vitamin K deficiency bleeding. In fact, most babies are not going to experience vitamin K deficiency bleeding, but we give it prophylactically in order to prevent the babies who would otherwise experience vitamin K deficiency bleeding from not getting it, or from not experiencing consequences from it. So you have something called early vitamin K deficiency bleeding, which is the first 24 hours, and then you have classic vitamin K deficiency bleeding, which is from day 2 to day 7, so that first
Mhm.
week. And then you have something called late stage vitamin K deficiency bleeding, which is like the second week to 6 months. And each of those stages poses a certain risk. So estimates suggest that classic vitamin K deficiency bleeding can occur in anywhere from 250 to 1,700 births per 100,000 births. And so, yeah, that is low. That's up to 1.7% of births, right? Which does not sound high. But
Yeah.
if you think that there's 4 million births in the United States each year, that's 68,000 babies. That's 68,000 babies that we're preventing, something that's 100%, almost 100% preventable, right?
Right.
With a single shot that has a very strong safety profile. And so I think when I hear people be like, it's such a, like, it's not common at all, so why do we need to give it to all the babies? I think there's just a misunderstanding about, like, first of all, how, when you say not common, how many babies that actually is each year, right? At scale. Because we're just talking about
Yes.
the US at 4 million, but think about it, the world, right? So at scale. And then also you have to contrast that with, like, weigh out the pros and cons. And the cons, I mean, this, you can speak to this as a clinician, but the safety profile of this shot is strong compared to probably
Yes.
even a lot of other things that are done in medicine.
Oh, absolutely. I mean, this is, and so when you look at that, right? So, yes, I love that you're talking about numbers and stats, because when we look at things, what we're always doing in anything with pediatrics, and anybody should be doing this as a clinician, is benefit versus risk ratio, right? So, we are taking the benefit of doing an injection like vitamin K, meaning looking at the, is there any risk of that shot? And like we said, I agree. There's very, very minimal risk. And the reason I'm not saying no risk is that nothing in life is no risk. I'm not saying
Exactly.
it because I believe that it's a risky thing. I'm saying it because if anybody is using absolutes, whether it's a clinician or someone on social media, you got to be careful. So that's why I say very minimal risk, because I have not seen anybody have a risk of vitamin K. We see children tolerate it very well, but I'm never going to say never, because it's a medicine, right? Like, it's an injection. Like, it's like any antibiotic you take. It's like anything we take, that yes, it is very low risk. But the thing is that although it is a low risk of getting obviously early classic or late stage vitamin K deficiency bleeding, the outcome of that is very severe. So
Yeah.
if we're dealing with like giving an injection, and I always use this example, like if someone's like, oh, we created an injection for hand, foot, and mouth, I will never recommend an injection, like a vaccine against hand, foot, and mouth. Why, Dr. Mona? Because hand, foot, and mouth is not killing kids. It's not causing them to be developmentally impaired. But
Mhm.
late stage vitamin K deficiency, which I have seen in clinical practice. And so, have I seen it a lot? No. In my residency, I saw it 3 times, okay, which is not a lot. But when you think about that, that's one clinician in residency as a resident seeing it 3 times. All
Mhm.
of the situations were children who did not receive vitamin K at birth. Okay. And it varied. Some of them were early stage. Most of the ones I saw were actually late stage. So between 2 weeks to 6 months. So one of them was a 3 week old, one of them was a 5 month old, and one of them was a 2 week old. So I'm seeing it. And the devastation that you see, you're never going to forget as a clinician. One of them had intracranial hemorrhages. So remember, vitamin K is there to help clot blood. So if you don't have it, you're going to bleed. So they had a brain bleed, and we went through the whole thing. We're like, why is this child having a brain bleed? You do all the workup. You think, is it trauma? Like, was it abuse? What's going on? And same thing with the other children. This one child I will never forget. It was the 3 month old who had bleeds down the spinal column and in the brain. So
Mhm.
first instinct as a clinician is you're going to think, is this abuse, right? Like I mentioned, because you're like, why is this kid bleeding? Because when there's brain bleeds and also hemorrhages, or when there's brain bleeds, you're going to say, was there abuse there? And we did all the workup, and then we finally realized through the history that the parents obviously did not get vitamin K through the evaluation and the clinical exam. That was the reason. And unfortunately, I don't want to, when you get a brain bleed at 3 months of age, it's not a great recovery process. I mean, yes, the brain is plastic. Yes, I know this as having a child who had a stroke, by the way, who is a whole other, situation, but I know that the brain can heal, but if we can do something to prevent that from happening, I'm going to do it, right? And so yes, 3 cases for me in my entire career so far, but that's only one person. You're giving us numbers, 68,000. I mean, that is something that we can prevent. And so when I see something that is the benefit outweighs the risk of getting the injection, and I know that the risk of the illness is pretty severe even if it's low, I'm going to recommend that because it's not something I want for my patients. Could they heal from it? Yes. I don't know what happened to that child because I was a resident, right? I don't know what that child's doing 5 years later or what 10 years later. I don't know what their developmental outcome is, but I do know that it is a long road of recovery when you have a brain bleed and now need early intervention. You need all of that when we could have prevented that with the injection. And the mom of that case, for example, regretted it. I mean, she's like,
Yeah.
from a religious standpoint, they didn't get the vitamin K shot, right? And I understand that certain religions don't have certain interventions, but she was upset, right? I mean, obviously she sees her kid now, but she didn't kind of know how to process that. And I remember at that point when you're a resident and when you're in training and you see these things continuously happen, whether it's related to not vaccinating, whether it's related to not getting vitamin K, whether it's not taking prophylactic, like not doing the antibiotics for GBS, all these things that we know that is low risk, but we know that the intervention is beneficial versus the outcome. That is why we recommend it. And I'm a mom, you're a mom. Like I said in the other episode that we talked about, I will never take the advice and give the advice of something that I wouldn't do myself, and or that I
Right.
wouldn't really like if I gave my kids vitamin K without any hesitation. I gave my kid hepatitis B. And you said it already, like when you have a little baby, of course I had the feeling like, "Oh, but now he's out here and she's out here. Do I want to do that?" There was a little part of me that wanted to hold off on intervention even though my medical brain knows that it's all okay to do because we're mothers. We want the best for our children and we see their delicate little body and we want the best, but I know that this is the benefit outweighing a risk. And
Yeah.
we're talking only about vitamin K, but it is a big deal and I get very emotional when I think about it because I see those faces of those families that could have been prevented. We could have done something different. Maybe if they had some other clinician recommend it or say, look, I know it's against what you guys believe, but is there any alternative here that we can maybe consider this? And maybe we would have gotten through. But I don't know. I can't go back in time. But what I can say is that if you're on the fence, I really think you should consider it. I think this is something that the benefit is there. And like you said, it's a very well tolerated injection. It's not a vaccine, and then it does reduce your risk significantly of having those outcomes of brain bleeds, severe GI bleeds, long term neurological impairments that can happen due to brain bleeds. That's not what I want for my babies because that's a longer road of recovery than obviously something that I can prevent.
Yeah, yeah, and I think hearing, I've heard from a lot of clinicians like you are speaking of, like who have seen these outcomes in the medical setting, and it's always they always say, the mom wish or the parents wish that they would have given vitamin K. So I think that those stories can be really important. I do want to just explain because one of the questions that I get, and it
Hmm.
triggered with me when you were explaining this, is why are these babies bleeding, right? So
Yes. Yes.
that's a big question. Like, well, why are the babies bleeding? Are they like what's happening? And I think the reason, and that can be sometimes said to me in a way of saying like we don't need the vitamin K shot
Hmm.
because like babies shouldn't be bleeding anyway, and it doesn't always have to be trauma based. So that can be one, right? Like you accidentally dropped your baby, the baby roll, whatever it is. But it also is because these newborn babies are still developing, and that
Hmm.
means their blood vessels are also still developing.
Yes.
And their blood vessels are not strong yet. And particularly, this is why we see brain bleeds so often in vitamin K deficiency bleeding as opposed to elsewhere in the body, because the blood vessels going to the brain are the weakest of all the blood vessels. And there's so many of them. And there's a ton of blood going to the brain in those first few days of life, in those first few weeks, first few months of life. And so there's a lot of strong kind of surges of blood going to the brain, and that can lead to rupture of those blood vessels.
Yeah.
And so that's where those brain bleeds come from. It's not that you're just dropping your baby on your head, and so if
Right.
you don't do that, like, your baby's not going to have a brain bleed. It's that it can just happen kind of as a function of your baby's blood vessels are still weak because they're still developing, and there's a ton of blood going up there to the brain. And so that's again where vitamin K, if the baby has adequate vitamin K, those brain bleeds won't happen because that blood will be able to clot, and it'll be able to stop those bleeds from happening.
Well, yeah, and that's exactly what happened to those cases that I'm describing, right? Like there was no trauma. You go through the differential as a pediatrician, like of the differentials of a bleed, and obviously trauma is part of that. But in those situations, it was not, like you said, it was just, it happened. And then the parents are like, well, how can, like, I love that you talked about that because they're like, well, how can it happen? And, I don't know if you know this, but in other countries, injection is usually the mainstay, right? I mean, sometimes parents ask about oral supplementation, but obviously the preference is injection versus oral.
Yeah, yeah. So there are some countries who
Yeah.
do where oral supplementation is much more common than in the United States. I will say that those countries have a completely different healthcare model than we have,
Mhm.
and oftentimes they have nurses who go to the house in follow-up appointments to help administer the oral vitamin K in kind of a 3-dose strategy. What we've seen in the research, though, is that the shot is more effective than the
Yeah.
vitamin K drops. And that is because that's when specifically comparing it to the 3-dose strategy, which is you give one dose at birth, one dose like a week later, and then one dose at 4 to 6 months. When you look at that, and why is that, right? So let's just talk about why that is, particularly in the United States. So first of all, babies are low in vitamin K. I think you asked me this as the first question, and I didn't answer it, so I'm sorry. So why are babies low in vitamin K in the first place? Well, vitamin K can't cross the placenta
Mhm.
efficiently. And so there's not, even if the mother supplements vitamin K, even if the mother's vitamin K stores are high, the baby is still going to be born low with vitamin K because they're not getting those nutrients through the placenta.
Yeah.
Babies also, I kind of mentioned this, they have low, they don't have the bacteria in their gut microbiome yet. That still has to be developed. So they're kind of born with sterile gut microbiomes. And so they don't have those bacteria creating vitamin K or synthesizing vitamin K like we do as adults.
Yeah.
So that's another reason. And then the other place we get vitamin K is from our diet, which is obviously like green leafy vegetables and from things like that. Babies' diet is generally formula or breast milk. And they're not consuming a lot of either one of those in the initial stages of life. And breast milk is very deficient in vitamin K. Again,
Yeah.
even if the mother supplements, vitamin K is low in breast milk. And so, for all of those reasons, babies are low in vitamin K. And so, when we're looking at, okay, well, what is the best strategy? Is it a shot or oral supplementation? Well, you have a baby who's very low in vitamin K. One option is you can give them a single shot at birth, and that covers them until 4 to 6 months when their bodies are going to start synthesizing vitamin K and they're going to start eating more vitamin K from their diets, right? And that's it, nothing else to worry about. You
Yeah.
compare that to oral drops. Now, I will say oral drops, it's very clear in the research, is a much better option than nothing at all, right?
Yes.
So that's important to say, and I think sometimes that gets lost in translation. So it is a better strategy than nothing, but it's not as effective as the one-time shot for a number of reasons. So one, it's not as synthesized, it's not as well absorbed in the baby's gut microbiome because again, their gut microbiome is not as developed as ours as humans, and so it's not as well absorbed. In the United States, we don't supplements are not regulated, and so vitamin K drops are not regulated. So you can't be sure that the
Yeah.
vitamin K is what it says it is. But an even bigger thing than that, because let's say you can find vitamin K that you're like pretty, that you trust the supplier. Coming from the research world, I can just tell you that supplemental compliance is absolutely awful.
Yes.
And also just working with people who, we generally recommend 400 IU of vitamin D to babies daily. And lots of
Yeah,
people
most
forget
people
to
are
give.
not, I can tell you, most people are like, "What day is it? Did
Yes,
I
they
did I
forget to
did I
give
change my
babies.
did I change my own underwear?" Like, they can't even remember to give. I agree with that completely.
Yeah, and luckily, vitamin D supplementation is completely different than vitamin
Yeah.
K
Yes.
supplementation,
And
right?
that
We're
I love
not.
that example, right? Because this
Yeah,
is much severe consequences than vitamin D deficiency. Yes, I would say that.
Exactly.
Yeah.
Exactly. And so you have all of those factors that have to be perfect
Yeah.
for you to even in the 3-dose strategy not even be as effective as the vitamin K shot. There is a little bit of research that looks as at a weekly supplementing strategy that has shown a little bit better effectiveness, but again, you have all of those factors to consider, and you have to make sure you're supplementing weekly, supplementing an infant weekly. And so when you compare that to a shot with a very strong safety profile, that's a one-time deal that's going to completely cover them for the 4 to 6 months. It's a no-brainer in terms of what the medical recommendations would be from the medical community.
I love it. Thank you so much for going into that because I do see that a lot on your posts, like people talking about. Sometimes I've heard like about the oral supplements, and I'm like, no, we don't even off like you said, we don't even offer that in our hospitals, and it is a one time thing, and it is very very useful as a one time thing. What advice would you give to parents navigating this decision in an era of information overload, misinformation overload, conflicting information? People are listening to us say, get it, it's something to consider, we really recommend it. Other people saying your child doesn't need it, it's big pharma. What would be your recommendation for these people wanting the best for their kids?
Yeah, I would just I always when I'm looking for information in fields that are not my own, I'm looking for somebody to explain things to me. So
Yeah.
if somebody's just telling me, don't take the vitamin K shot because it makes your baby's blood sludge,
Mm,
and they're not explaining because that's the one that I hear all the time.
yeah.
And that's just a misconception and a misunderstanding of what viscosity is in blood and what it means to be able to clot, and that actually clotting is what you want. And it's not sludge at all.
Yeah.
Right? So if they're not explaining the evidence to me behind that, then I immediately and it sounds kind of like it goes first of all, if it goes completely against conventional wisdom, right? Conventional recommendations, consensus recommendations, I should say. Then, if it does that, I want an immense amount of evidence behind what they're recommending. And if that's not there, and it sounds kind of fear mongery, that would be my first red flag. So I kind of look for that in areas that aren't my area of expertise to see like where my trusted sources are, and just so trying to identify like some trusted sources. What I love about like the content that you put out is you do such a good job of it just explaining the why behind things. And
Yeah.
I think that can be really helpful for people because it's like, okay, well, why do I have to give my baby this shot? Right. And so just discussing like the why, and if somebody's able to explain that to you, and you can find those trusted sources, and they're saying one thing, and then you hear, somebody with absolutely zero credentials saying another thing, it kind of makes it easier to figure out who to believe.
Right.
And so I think that can be really helpful in navigating. But getting adequate information, I wouldn't say more information is always better, but getting adequate information to actually make an informed decision. Because a lot of people out there like to talk about informed consent, and then they like to give you incorrect information and call it informed consent, and that's kind of doing a disservice to everybody.
This is another reason why I love following you. I'm the same way in terms of if I'm not an expert in something, I'm not going to speak about it. And I believe that the best informed consent and getting informed information is from someone who can give you the benefit and risk. And oftentimes, as we know, with people who are spreading misinformation, they tend to just say that it's harmful, it's harmful, it's harmful. Don't do it, don't do it. But they're not talking about what we just talked about, which is yes, the small percentage of individuals that do get late stage bleeding or early stage bleeding. And so that's what we're taking into consideration. And I use this for vaccines too. I have a whole, and I appreciate you always sharing my vaccine guide. That was a labor of love to put together, talking about the benefit and risk of every single vaccines, because I want people to make informed choices and say, hey, this is why I'm recommending it. But I want you to know that no one's hiding anything. I do see febrile seizures with the DTaP vaccine, or I do see this with a febrile seizure with MMR. Like I want people to know that I'm not hiding anything, nor is the people that are making these decisions, like the AAP and CDC. It's all on their website. I mean, it's everywhere, but people are choosing not to say that. And so thank you for the work that you do. It helps me as a pediatrician, and obviously I love following you for all the nutrition and pregnancy and early childhood. All of it is so useful for me, and we've spoken so much about how this platform for each of us has grown us into these better clinicians, better educators, and I feel that way by knowing you. So thank you so much for joining me, and also just that comment you made about me, because the feeling is mutual.
Yeah, thank you so much. I totally agree.
And where can people go to stay connected for all the things that you're debunking, but also just the amazing education that you continue to provide?
Yeah, so I would say just I'm active on TikTok and Instagram. So same username at both of those places. It's Dr. Jessica Knurick, my name. So Dr. Jessica Knurick.
Thank you. Well, it was such a pleasure having you on again, Jessica. I really appreciate it.
Yeah, it was wonderful to be here. Thank you.
Yes, and for everyone tuning in, if you love this episode, make sure to hit that thumbs up sign and comment. We love hearing your feedback on our show, and I cannot wait to have another guest next time.